Hi, I'm Connie, and I am here with Dr. Anu Bajaj of Bajaj Plastic Surgery, and we are going to talk body contouring after weight loss. That's a mouthful. What is it?
So, body contouring after weight loss is when we essentially what it sounds like contour your body after
your weight loss sounds like it to you.
But what that means is a lot of individuals in the past, they would have bariatric surgery or even lose weight with diet and exercise. Today's world, with the popularity of all the semaglutides like Ozempic and stuff like that, people have been losing a lot of weight. And, whether it's assisted by medication or surgery or diet or exercise, the effects to your body can be the same. And that is you lose the fat, but now you have excess skin that doesn't stretch back to its normal configuration. And I always tell people, think of that rubber band. You stretch and stretch and stretch that rubber band, and eventually it just can't shrink back to its original size. And that's where body contouring surgery comes into play.
What are some of the procedures that are included in that?
So probably the most common areas that people are concerned about after weight loss are their abdomens. In other words, how you get that loose skin or that loose pooch on your belly. The other things that I see many women come in to talk to me about are their breasts, because their breasts also start to sag more. And then other areas are, your back, your arms, and your thighs. Basically, most areas of the body, depending on how you gained weight and how you lost it, can be affected.
There's a trade-off, right? So we're going to get that silhouette from doing these body contour procedures, but what are we trading?
So the trade-off is we're trying to trade an improved contour with a scar. So for example, if it's the abdominal tissue that we're trying to remove, we're going to get a flatter, more contoured abdomen, but the trade-off is you have a scar right above your pubic hairline. If it's the arms, you can get rid of your bat wings, but the trade-off is you have a scar along the undersurface of your arm. So we place these incisions strategically to minimize the visibility of these scars. But essentially, that is the trade-off, is an improved contour so that your clothes fit and drape better, but you do have a strategically placed scar.
Strategically, exactly. And it heals because it was done intentionally. This isn't something that, when you run into something sharp or whatever, you end up with this scar that's different than a plastic surgeon placing this incision purposefully and also bringing you along through this recovery of and the different tools that you have in your toolbox for wound healing. But what about diastasis recti?
So diastasis recti is the separation of the rectus muscles. And your rectus muscles are your six-pack muscles. So when you stand up or you look at the magazines and people have a six-pack, their muscles are usually together side by side. A lot of times, either with extreme weight gain or with pregnancy, those muscles can separate. And just like your skin won't contract back after it's been stretched out so much, the muscles don't always go back together after they've been stretched out so much. And so one of the components of doing an abdominoplasty or tummy tuck is to suture those muscles back together to bring them back to their original anatomic configuration. Now, one has to remember, this is an anatomical correction. It's not something that's related to your underlying core strength. And I would advise all of my patients that if they want to maintain that flattened appearance, you really also have to work on your core strength after surgery.
As well as, that kind of leads me into this other, kind of topic or side topic about recommendations for patients on strength training before surgery.
When you lose weight and have surgery, you want to optimize your results, right? And I think that strength training before surgery will help you with your recovery process. I think it allows you to withstand the different things that occur because your body is stronger and able to handle that stress. Strength training after surgery will enhance your results, right? Because if you've lost all this weight, spent all this money on these surgeries, you don't want to jeopardize the outcome. You want to have the best outcome available to you. And maintenance of your new physique is important, and that does include diet and exercise. And I think strength training is an important component of that for the entire process.
I agree. And also, as women, we know that it's important for our bones. We know that it's important. Muscle burns fat already, like a pound of muscle already burns calories. So lots of good reasons for us to be doing regular strength training. But there's a lot of our weight loss patients, or a lot of your weight loss patients, they're losing weight because they're, doing all the right things and having a healthy diet and being active. But then it's going to be surgery day. And then after that, they're not going to be able to maintain that same amount of activity. So how do you kind of talk them through taking that break? And
so that's another reason why you can strength train before surgery. So you're a maximal effect beforehand, so to speak. But it's important after surgery to allow your body to recover. You're going to be walking right away. And we can gradually start increasing your activities to body weight types of activities by about the 3-week mark, and then gradually allow you to return back to your workout routine over the next 3 to 6 weeks to 8 weeks. And I think that's an important thing, to be patient and give yourself grace.
what is your philosophy on liposuction?
So liposuction is not a weight loss procedure. It's a body contouring procedure. In other words, we use liposuction as another tool to ensure that we can get the optimal result following any type of body contouring without without bulges or weird shapes that we don't like. Liposuction is designed to help us remove and contour the body and get rid of those stubborn pockets of fat. But it's not going to be something that's used to allow you to lose weight, which is why when you consider body contouring surgery, you should be at your stable weight. That's your realistic goal weight, and have been at that weight for at least 3 to 6 months, because we don't want you to waste your money and then regain all your weight after surgery.
Right. Oh, that would be tragic. But how often would you say that you want to pair that with these body contouring procedures?
Oh, with the liposuction, I almost incorporate that with all of my body contouring procedures, because it's another tool to help ensure that we get a good contour.
And especially these patients, when they are extreme weight loss, or, basically any kind of weight loss patient, then they've done all the hard work. And what's left are those stubborn pockets, right? So they've done that. And then you have this beautiful, say you do an abdominoplasty, and you see if you had done no lipo versus if you had done lipo. And there's that like really nice waistline, especially with the diastasis. I mean, I'm telling you, like, that always brings that waistline in. The roundness that you get from, especially after pregnancy, it's so hard, even with lots of core strengthening, physical therapy. There's really no substitute for
the surgical repair.
Yeah.
I think you need to understand that even with the anatomic repair, you're still going to have to work on core strength.
Right. Tell me about pairing procedures, right? So when we're saying body contouring after weight loss, that's not just one thing, it's a few things. How many can you pair together? What are the ones that you can do all at the same time?
So as we mentioned, that the common areas are the abdomen, breasts, thighs, arms, back, buttock area. So that's a lot.
That's a long day.
You can't do it all at once. And the guidelines...
Give me the reasons why. Why can't you do it?
You can't do it all at once because it's not safe for the patient. It's too much surgery. It would take too long, and it's a lot of time under anesthesia. It's not safe for the surgeon because surgeon fatigue is real.
And then how do they recover? How are they going to get up out that?
I mean, yeah, like if you've had surgery on your arms and your legs and your belly, I don't even want to think about that. But most some institutions will have different rules about the length of surgery. But what the general recommendations are by our American Society of Plastic Surgeons is that if you're performing an outpatient surgery, you want to keep it under 6 hours for patient safety. The other thing that happens is the longer the surgery, the higher the risks are for things like DVT, which is a blood clot in your leg that can travel to your lungs and can ultimately potentially cause death. There's a higher risk for having losses of fluid and higher risk of infection, higher risk of blood loss. So in general, you want to keep the surgical length down to something that is safe. And so my goal is to keep it under 6 hours. And that determines how we pair the procedures. In general, I believe you want to stabilize the trunk before you start dealing with the breast, the arms, and the legs, because dealing with the abdomen with an abdominoplasty and the back or buttocks with the posterior body lift also affects the thighs. And so if you can stabilize the trunk first and then go on and do the thighs or the breast or the arms at a later surgery, that ultimately gives you a better result. So in general, the surgeries are staged. And when they're staged, that means we may do a circumferential body lift as the first procedure, then do the breast and arms as another procedure, and the thighs at a later procedure again. So it can be 2 to 3 surgeries. And then another common question is, well, how long do I have to wait between procedures? And I tell patients it's generally a minimum of 3 to 6 months because you want to allow yourself to have healed and recovered from the first surgery. And you also want to start minimizing your risk of DVT. And the literature shows that after the 3-month mark, your risk of developing a blood clot in your leg returns to baseline. And that's probably the most feared for complication in these types of procedures. The other reason people would like to stage them is their budget. I mean, it's difficult to do 3 surgeries in 1 year because they're all major surgeries. So in general, you want to space them out a minimum of 3 to 6 months apart.
Great guidelines. And do you see a lot of repeat customers, patients coming back because they've done something and then they come back to you?
So a lot of patients will come in and they'll say that the first thing they want to address is their tummy, and then we'll do it. And then after they've recovered and healed, they get excited and now they're ready to address the next thing on their list. So yeah, and I like that. I want to see my patients over and over again, not necessarily have them go elsewhere either.
Shopping for someone else. And being in practice for 20 years, then you obviously have given the patients an opportunity to, age out and now they're in the facelift, right? We are seeing patients who are in the facelift category that had previously done body surgeries.
And that's another thing to keep in mind is we don't talk about it as much, but our faces are also affected by weight loss because we still lose elasticity in our faces, and we'll notice that our faces sag more after extreme weight loss. And so I think maybe that's another component that people are starting to see and pay attention to more now as well.
We've seen the buzzword Ozempic face, right?
Yeah.
Ozempic skin. And so now how are we going to battle that? Fat transfer to the face, fillers. What is your philosophy there?
So it depends on what the patient is like. So some patients would benefit from filler and skin tightening devices. Other patients really do need a surgical facelift, neck lift, and potential fat grafting to restore some volume and shape to their face. But it's an individualized approach, and it really depends on what the patient has.
And you do all that head to toe, right? You can operate on.
That's the beauty of plastic surgery, and that's truly why I became a plastic surgeon, is because it's the only specialty where you can operate everywhere on the body. And to me, that's what makes it exciting.
So I don't need to go to like a breast surgeon and then have to go to a face surgeon and then go to a abdomen surgeon, that all these different specialties like we do with our heart and our lungs and our brains and all these different specialties. Plastic surgery is
plastic surgery is a broad-based, and I would say it's a principle-based specialty in the sense that we learn about basic principles, and then we apply those principles to the rest of the body. And a board-certified plastic surgeon is able to operate essentially everywhere on the body and do all those procedures, including face, eyes, breast, arms, belly, thighs. A lot of surgeons tend to subspecialize, and that has more to do with the procedures they enjoy and the procedures that they feel like they're best at. And so that's an individual surgeon choice. I actually enjoy all the procedures, and I feel that by doing everything, it keeps me fresh because I'm always reading, always studying, and always learning. And that's how I get better because I don't ever allow myself to get bored or stale.
Mhm. And if you had to choose, because people ask, what's your favorite procedure what's your favorite procedure to perform? Can you even pick one, or would it just be like, man, if I did the same thing every day?
I think it depends on the day. I mean, I enjoy doing it all, so I don't necessarily have a single one favorite. And the other thing that makes it enjoyable is seeing the effects on patients, right? If a patient comes in and they're happy or they love the changes and they're like, oh, wow, this made such a huge difference in my life, that's my favorite procedure for the day.
You're right. So it's not necessarily even the surgery, the procedure itself. It's what did it do for this person's quality of life, just on a daily, basis that they didn't even think was going to, be something that they would have experienced before. And now they're able to, maybe they're at the 3-month mark and they have so much more mobility, so much more stamina. And I'm really kind of talking about those body contouring procedures where if they're carrying around a lot of extra stuff, breast lift patients, that really interferes with their daily activities, right? Tying their shoes and reaching the bottom of the
Things that you
washing
wouldn't even
machine.
consider.
Yeah. And now it's like, oh, these really amazing. And getting that feedback at the follow-up appointments. Those are the things that really are fulfilling.
That's what makes it fun.
That's so fun. Well, if you have any questions about body contouring after weight loss, you can give us a call at Bajaj Plastic Surgery, and we'd be happy to talk you through what the options are for you and get you in to meet Dr. Bajaj.